Good afternoon, everyone. Thank you for joining this ongoing New Hampshire COVID Vaccine Alliance Zoom meeting. We've been running these since mid-December. And just to go back again, and as we always do, if you're new to this, our mission here is really to help convene various stakeholders across the Granite State to promote vaccine confidence, support accurate and consistent vaccine messaging, and foster coordination of the vaccine allocation process. Our goals are to promote buy-in for the vaccines to increase immunization rates, to act as a multiplier force, and this is probably the most important one, for the communications and allocation plans for the Bureau of Infectious Disease Control immunization programs, counter any misinformation on the COVID vaccines, and then foster the use of New Hampshire's immunization information system. Going back, again, we're kind of from our previous meetings, we're continuing to work to round out second doses for 1A, make sure that they're going to the fixed sites. If people are having problems, then we've been asking that they email the COVID vaccine scheduling email, plus copy myself. Next slide, please. We'll keep going. You recall that we're still trying to work for the medically vulnerable populations, and there are processes on the vaccine information site for the state, and those forms still can be used for anyone under 65 who's medically vulnerable. There are some different forms for those who are 16 and 17 years old, special forms that are there that are part of a memo that's also on the vaccine information site. Next slide, please. There that is, the information on the 16 to 17-year-olds information. That's also on the vaccine information website. And finally, I think we have one more slide. I'm just, again, thank you to our sponsors. So again, we're here. TW, thank you again for joining us. We really do appreciate it. So I thought I would just kind of start with kind of open-ended question. How are we doing in both the kind of the 1A and phase 1B? Do we have any kind of general numbers we can kind of inform people how we're doing on the progress of those two phases?
Sure. So just last night when we ran the numbers, we passed the 100,000 dose mark of 100,000 first doses administered. I think the governor will be probably bringing that up to speed in terms of his numbers that he announces out later on today. And so I think overall we're doing well. I think that as we go and as we work through our efficiency patterns, I'd always like to see that number improve, right? And I want to get to the point where doses each week are administered in a quick in, quick out. We're in the process of improving that, and I think we've had dips and waves in which we've done that and come close to that most weeks, and continue to keep coming close to that. I think where it becomes challenging is that as the vaccine spreads out, right, you have two concepts in a response that kind of war with each other. First is quickness, right, which is the shots in the arms and making sure that those that want to get it and get that quickly. And then the second is the equity piece and making sure that people that can't generate that speed by themselves because of being asset poor, or whatever it is, right? We want to make sure that those people get accommodated at the same time with that. So it's not all about the speed. It's also about, making sure that these groups are coming to the table and working through good partnerships with them. And so with the counterpoint to that is then having conversations with different organizations and trying to come up with programs that make sense for our FQHCs and our rural health centers, and how we're doing in terms of that 10% equity and whatnot, to try and work through all of these different areas and yes, move vaccine quickly, but also make sure that we're not moving so fast that we're leaving people behind that we shouldn't.
Great. More specifically, do you know about how many registrants you've gotten out of the phase 1B, approximately?
Sure. So I think right now the last number that I was tracking was around 330,000 people that had signed up for phase 1B.
Okay,
And
so
that,
that's pretty close to the targeted initial target amount. So it sounds like we're doing really good, at
yep.
least getting people into the system. Congratulations on that. We know it's been a challenge. And also the other thing I understand is our supply is beginning to creep up. Where are we at this week in supply for the state, or what's the estimated amount?
Yeah, so we just passed with first doses this week. We just passed the 20,000 mark, and I'm sorry, I don't have the exact number off the top of my head, although I should. So we have creeped up from the 17,000. We haven't creeped up a lot, but we've creeped up a little in terms of how that goes. And that speaks to an additional way that we're going to start to get doses in this week. And so I wanted to take some time to talk about that if I could.
Good, please. Yeah.
And that is through the federal pharmacy partnership program. So up till now, the partnership program at that the feds have done has been for long-term care facilities and whatnot. They are now switching gears starting this week and doing it to in-store vaccinations throughout the state. And so we were strongly encouraged to pick Walgreens because of it was one of the people that CDC had an agreement with that had the most amount of different locations throughout our state and kind of geographically diverse locations throughout our state. And so we ended up going with that. There are 34 locations for Walgreens throughout the state. We could not dictate with this program, because it is a federal program, where those doses went. So we had to pick one of a few options to pick which partnership program that we went to, which is why it didn't necessarily go to our FQHCs or another way that we particularly kind of wanted it to go. We fought as a state to try and get that, but New Hampshire is in a unique place where we kind of gamed out. We have a really good structure, a really good plan and things like that. And so we're one of the few what we call awardees, because there's states that have awards. There's vaccine awards, there's cities, and there's territories that all have vaccine awards and allocations and are fighting this good fight with us. And so when you talk about that and you work through that, what that means is New Hampshire's in a unique position where we do have people in a queue lined up. We do know where we want it. And instead of a second arrangement starting up, I really just want those doses, right? So that we can then implement them. We're not short vaccinators, we're short vaccine, right? And so, but at a federal level, that's not the case. And so that's why we weren't allowed to necessarily have say as to where those go. But the positive out of this is that we have been able to work with Walgreens to try and help funnel patients that are already in the queue to go there, right? So what we don't want is we don't want a situation where we have kind of, a feeding frenzy where we have, 3,400 doses open up and 60,000 people try and register for them. They lose their place in VAMS, they reshuffle, they're not quite sure where they're at then. They get an appointment even later than what they got before, all that sort of stuff. So in that, the way that we're working with them is directing them to kind of take on chunks of the people that are signed up and working through that with us. And I think that's the best of all worlds. So the good news is we're getting 3,400 more doses into us, and we're still using that funneling stream, but it's coming through that federal allocation.
So 3,400 new doses through the federal allocation process, and in the state of New Hampshire, that's through Walgreens. And so if I understand this right, so will Walgreens be contacting these individuals, or will the state be contacting these individuals, say, you can move up and you can get it on this date at Walgreens?
So it'll be the state that are contacting those individuals, and we want to do it in a way that, again, the customer service side of this is as seamless as we can make it. And so the goal is to be able to direct those people directly into Walgreens. So we don't want people to necessarily reach out to Walgreens or whatnot. And our communications group that are much more eloquent than I am, and their communication group will then figure out how to message that to the general public.
So this will probably be discussed by the governor probably some later today at his press briefings. That's good to know, and we'll go more into to depth on those doses. But it sounds like if you're already in the queue, then these will be individuals that then the state will kind of queue up and ask if they want to move up and have their doses at Walgreens.
Yeah, I think this also gives us the ability to take some of the people that are having trouble getting into the queue, right? Also, we started off with a list of a few thousand people that had trouble getting into BAMS or had gotten kicked out or gone into a closed pod or all these different things. And we've slowly whittled that down to about 1,000 now in terms of people that we're still trying to make sure that we're taking care of. And so it gives us some flexibility in our response to try and assist.
Great. And if either practitioners in 1A or if the patients in 1B, if they're still struggling, is it still best to either go through 211 and through the COVID vaccine scheduling email? Are those the two best methods to do?
Yes, sir.
Okay, good. That's great to know. And so it sounds like then we're going to move up to about a little bit under. We're going to about 2,400 doses or something like that. Somewhere between 2,400 and 2,500 doses in. And will this program start next week with Walgreens, or is that a couple weeks away?
So actually, it's we found out that it's starting this Friday. So we're in the process of contacting those first 3,400 and working through that. So yeah.
I'm sure then that the various Walgreens across the state, they've already been designated, and so those will be where individuals from various parts of the state are being directed to. That's great. Well, that's great news as we come forward. So given that, have you started projecting about when you think 1B is we're going to potentially be able to wrap up? Do you have a guesstimate? Is that the end of March or are you still working through those?
To be honest with you, I'm still working through those, and the reason why is because it depends on the messaging stream as to what we're actually getting, right? And so I kind of take the stance as the operations lead right now of show it to me in the allocation, right? Show it to me in the actual doses that we're getting, not in necessarily a press conference or something else at the federal level or things like that. We've been messaged that our allocation to our state should increase significantly in the next couple months. But what that is and where that actually goes, our goals right now are to be ready for that in terms of capacity, right? If I'm doing my job right, then allocations will continue to be our limiting resource. And whenever we see a surplus in that, so I do have data teams that run through and each week they say, okay, so we didn't go through it in X, Y, and Z. Where can we move that to try and tighten that up? So, and that's a continual, process, the improvement place, right? Because I want to make sure that there's enough doses out there that we're not running too lean and we're having customer service problems because of that. But at the same time, we're constantly trying to tighten it up so that we're pushing out as much as we possibly can.
So right now you have doses going out into early April. But you think that over time you may be able to bring those back, and so
yeah, I think that when it's all said and done, if I had my crystal ball and it was working perfect, I would say that we will probably finish up sometime in March, depending on how allocations go and whatnot. The hard part is the actual allocations that we can forecast for the next 3 weeks. That's in the planning tool that Operation Warp Speed gives us. Doesn't give any increases in allocation right now. So the next 3 weeks, if I was going just off of that tool, it's going to be constant. And so that's a good chunk of February. So, that is all the rest of February. So, so it's trying to take that and kind of work that in with a grain of salt, so to speak.
Great. So one question on the, there's other, I guess, pharmacy chains that are interested, while the federal plan is with Walgreens. Do you anticipate that other pharmacy chains, either by direct agreement with the state or some other kind of jurisdictional transfer, will also be part of this distribution process moving forward?
Oh, absolutely. So let me talk about that for just a sec. So, we have had well over now, I think we're up in the 300 or 400 range of vaccine provider agreements that have come in. And that's thanks to all of you. That's thanks to pharmacies. That's thanks to a wide group of people that are interested in helping out. And that's where I say our vaccine administrators, right, are our surplus in our state. And that's where we're unique and in trying to set up these systems. So the goal, though, is to set those up in such a way that I turn on. I use myself as an example, so I'm not picking on anyone, but I'm setting up TW's pharmacy. I want to make sure that TW's pharmacy can be guaranteed a certain allotment each week, right? So that speaks to a gradual increase of vaccine and amount and how we do that, and making sure that whoever comes on as an external partner has a nice, clear methodology. They can count on this. They can work through those resources. It's not, hey, I got 50 doses. Can you use that? It's, hey, here's 50 patients. Here's 50 doses. Here's what, can I count on you to do this with your rate and rhythm that you can do this each day, 5 days a week for the next few months. And that's why we've worked through messaging on our provider agreements, and we'll continue to do that for open pods and things like that. Again, we're trying to open stuff up, get stuff ready, kind of get things gamed up, if you will. And so in the next few weeks, we'll be reaching out to do that and try and open that up and have those conversations, make sure that we're set up in a good way for those that are willing to vaccinate not only their patients, but others. And that's what I'm talking about with that open pod.
Great. Let's also, before we jump into questions, you also started on Sunday another process of automatically, as I understand it, doing second doses. Rafael, can you explain that a little bit more and how that's working thus far?
Sure. So just as a segue into that, the other update that I wanted to give you is right now our fixed sites are running 12-hour days, 7 days a week, and they're doing that for the next couple weeks. And as we work through that and work through our efficiency and what those next steps are, our goal is, again, have the right safety stuff in place and things of that nature, but also try and be as efficient as we can on the state side of this so that we can match that and expand and grow our process, as well as opening it up to more external partners and going from there. So that's that process of doing different things. And so this week we started off with something that the governor requested of us, that was basically a process in which someone gets a second dose appointment card right at the time of their vaccination at the fixed sites. So the idea was this, that for the majority of the population, VAMS was working, believe it or not, good, even though it doesn't seem like that at times. The majority of the population could get in and they could get their they could get registered. And if they couldn't get registered, they used the phone lines and they got that first dose appointment all set up. There was concern out of the population that could not do that population might grow with second doses or things like that. And so when we were trying to put that together and figure out what that looked like, that's where we went, okay, so if we go low tech for the second dose appointment and we work on all of that from the back end to make sure that data is all good and nice and clean and whatnot for the second dose appointments, that's what we're gaming through right now. So as someone pulls up to a fixed site starting this last Sunday, as people pull up and they get a first dose appointment, they'll get a second dose appointment card with that has a date and a time that they know that they can come back for their second dose appointment.
Great. And is that once that happens, they receive their card, do they get any more communications through VAMS or anything else?
Yeah, so we're working on gaming out because now we're going outside of the VAM system, right, to do this. And so we're working gaming out different systems that allow for a reminder and things like that to just remind people that there are appointments coming up and so on and so forth. So we're working through what that looks like. And obviously, as we partner with Walgreens or we partner with other people have those reminder recalls built in. And so that'll be one of our goals that we do, is obviously try and make sure, hey, don't forget your appointment.
Great. Just coming back to that, that's terrific. Thank you. So if I've heard you right, the 13 fixed sites, they've moved to 12 hours a day, 6 days a week. Is that correct?
7 days a week, actually.
7 days a week. Okay,
Yep.
so 7 days a week. So on the weekends, and I guess Walgreens will determine how their frequency depending upon the number of doses they're delivered.
So right now, what they're working through is basically trying to get through. Think of it like a contract, right? It's not a contract with us, but it's a contract with the feds in which they have to demonstrate good throughput. So those 100 doses, the on the federal side, they don't want them to sit on those doses either. So they want to get them through those 100 doses in a 2 or 3 day period. So if they start on a Friday, they want them to be done with those 100 doses at each of those sites by a Saturday or Sunday type of thing.
And is Walgreens right now, initially, then other pharmacies, are they administering second doses, or is it also first doses?
So they will administer second doses to the people that they administer first doses to.
Okay, so if you got a first dose there, but you're also are you sending any to Walgreens for just second doses, or is it a combination?
At this time, we're still gaming out what that looks like. We opened up several second dose appointments, and right now we're showing that there's second dose appointments in the rest of February for each week, as well as the first week in March. And then after that, people are getting those appointment cards to move forward. So as we look and see what that is right now, we're tracking that there's still several open appointments throughout the different fixed sites and locations. And so as long as that stays consistent, we're okay with that. And we're working through that, then we may not transition second doses. If we start to see an influx and go from there, then we will look to Walgreens as well as possibly other providers, right, to help out with second dose increases and things like that. So it's a matter of trying to make sure that on the off side, we're gaming at and we're expanding our capacity, whether it be first or second doses, before we actually have the need to do so, right? So that we're not behind the ball.
And so is the state capturing data on second dose administration? Is there a plan if a patient is a no-show? How does that work?
Yes, so we are capturing it, but like you say, it is brand new, right? So trying to figure out the percent uptake of people that had a first dose, and then obviously we wouldn't encourage this, but for whatever reason they don't want to get a second dose. And things like that. There's always, when you live in the world of vaccination, there's always a completed series, right, that we go after. And for this series for COVID, it's 2 doses right now, and working through that. And so we want to get that 100% capture as much as we can. At the same time, we recognize there's going to be a percent of people that move away or choose not to do it or things like that. What that percentage is something that literally right now we're about 2 weeks into, at the fixed sites of what we've done for second doses that have people come due as we've done that. Maybe we're 3 weeks now, but it's not very far along, right? So because it's not very far along, we're still working on our metrics to see what that percent is and so on and so forth, because I don't want a second dose just sitting there when it can be used. And at the same time, it needs to match, right? And as you move that forward, if I use that as a first dose, I have to have another second dose somewhere that I can line up with that so that I can make sure that the series gets completed. So it's working through it and learning as we go and trying to make things as efficient as we can.
Great. To the extent, does Walgreens, like the state system, have some kind of post monitoring for the vaccine? First and second doses, is that part of their contract?
That's a good question. My understanding is that it is, but I haven't seen that contract. So it'll be something that as we continue to have conversations with them that we work through. The understandings that I've had is that they would follow all the safety processes, they have the emergency protocols in place, and those safety processes include that 15-minute wait period. So we've talked about that at a very broad level with VPs and things like that. We just need to make sure that all gets implemented.
Yeah, one of our participants is asking, just to clarify, will second dose appointments be required for the same site, or does that person have the ability to visit a different site for the second dose?
So ideally what we'd like is for them to visit the same site that they got it. And that's because of the switch to appointment cards and things like that. If it ends up creating a problem, which it will for some people, right? The downside of actually giving you an appointment and time and schedule right then and there at the site is that you are locked into that, and life happens. And so then we need to create the system that's going to account for that, and that's reaching out to 211 if you have scheduling or difficulties and things like that, and working through that. We also know that we need to expand our call center capabilities, right, with this latest change. So we already recognize that for some people on the appointment times that they've been calling, 211 has stayed consistently below 30 minutes, and our call center for scheduling appointments has fluctuated between anywhere from a 15-minute up to all the way to a 40-minute to a 45-minute hold. And we definitely don't want to get that long, right? We want to scale that back and try and keep it under 30 minutes. And so as we work through those growth challenges, who'd have thought in my career that I'd need to think about this as Amazon carriers and as call centers and things like that. But we're working through those, and we're trying to get people that are knowledgeable in those types of systems to come on board with us and help us out and try and work through those challenges as quickly as we can.
Another question, thank you very much. Another question, again, with the Walgreens system, and I know I'm sure the government will have a lot more information, but people were funneled to Walgreens, or who basically get that call to move up. Then will they get a call, or will they get an email from the state, or will that verification email come from Walgreens? Do you have a sense of that?
So it will come from the state. I know that in terms of the scheduling. And right now, I think we're gaming through how to do that quickly. So there are some text message capabilities. People have listed cell phones and things like that we could do, so that we're not calling all 3,400 patients, but we're allowing them to communicate back and forth with us through text saying, hey, your appointment time has been moved up. Can you do this at this location? Yes or no? Yes, I can. Great. Then, please, go to this Walgreens at this time and this date. Or no, I can't, and go from there. So some of these are going to have to be phone conversations. I know that we'll do our best to leverage technology as best we can with the capabilities that people have to match that up. We also recognize that right, the population that we're after, right, to do this with are not necessarily the most tech savvy populations that we're working through. So we got to, as we implement a new process, we got to flex and move with it and make sure that whatever we're doing, it's the right fit for the right patient, the right customer.
Ultimately, if a patient gets first, second dose of vaccine, is there a way for a primary care provider to follow up to see if, rather than just calling the patient, does that information reside in IIS yet, or any place else that they can check?
It does reside in the IIS, with the exception of a small carve out, which is the pharmacy partnership program that happened at the federal level. We're still working through trying to get that data back from us, and we need that back quickly. So we've been working with them for the last few months to try and get that repaired and fixed in terms of the systems that are behind. It's not our state systems that are causing this. It's at the level of Operation Warp Speed and the transition of that data to us. But beyond that, yes, most of it does live in the IIS. And as we roll out the IIS, we'll be giving usernames and passwords and things like that so that providers can do that, as well as ordering and everything else as we transition from our old IIS to our new one. And so we're gaming through what that looks like and things like that. We also have a patient portal that we'll be working through to try and allow patients to have access to their records and whatnot. But as we do each one of those things, there's some challenges to it. It's unfortunately not just as easy as a snap of the fingers. So, for example, on the patient portal, you have to have your first name, your last name, your email address that was used for you, and your telephone number that was used for you. Otherwise, you can't be verified in the system. So there's going to be some starts and stops to getting this data back.
Great. At this point, all the pods are currently open. Is there plans at any point in time to also include closed pods, or is that not been considered because of the limited supply?
Yeah, so right now you're absolutely correct, and right now we're looking to do open pods because our allocations are so restricted. There will come a tipping point in which we start to look at closed pods because that makes sense, right? Eventually, if you take a closed pod in its essence, right, it is me as a practitioner working with my patients, right? That's really what a closed pod is. It's not just the general public stuff. So as we work to those models, and pharmacies and urgent cares and things like that are different in that model, but as we work to that, that is eventually what it will become. And so we will have a transition period to get to that point. The question is just when and how does that occur, and that will become largely dependent, and that's what it has been dependent as, on that allocation and where we're at with that rhythm.
That's great. Oops, and I just lost my screen for the next question. So one of the, I guess what I'm hearing back from some of these is that calling 211 still appears to be the best way to get scheduling issues resolved at this time. That there is a bit of a backup using the email. You're working on a backlog of those. So that's good information that we're getting from various individuals out there. Are there any rough estimate timelines of when locations, hospital clinics will start getting vaccines out for the timing of other open pods or timing of close? Are you thinking more phase 2A, or is it really dependent on supply?
I think a couple of different things. So yes, I think we're incorporating it into our plans in terms of when we open up with other partners. I would see this start to happen. The earliest that I would see this happen would be last week of February, and then in through March. We would look at trying to open up different open pod providers to try and work through that. And I think the goal is again to spread out, but spread out in a way that we're managing what we already have in the queue. So as we work with these providers, some of the challenges that we'll need to overcome is giving them a set of patients along with that vaccine, right? Because we've got this long queue set up, whether it be the telephone queue or the appointments in the schedule, and we want to work off of that to do these open pods. So it's a matter of setting that up, making sure that our infrastructure is strong so that we can help support that transition, and then support that transition and get that to our external stakeholders so that they can do a great job and join us in this effort in a different way, because all of you have been working so hard in a wide variety of ways to do this.
And this might be a little bit out of your purview, but are you aware of how any patient symptomatic reactions, that kind of information is being conveyed by the federal government, or is the state doing any kind of roll up on statistics that they're doing through BAMS or anything like that?
Yeah, so the statistics are being done. So adverse events are being reported through VAERS as they have done throughout vaccination history for quite a long time, and that is a system that requires the clinician to make a judgment call as to how severe the reaction was and things like that, whether or not it should be reported to VAERS or not. There is also the CDC methodology that it's being used in terms of adverse reporting, and that's the text messages that they send out, and they send those out in a certain battle rhythm. So I think it's every day for the first 2 weeks, and then it's weekly after that, after you get your first and second dose and things like that, to just kind of see how you're doing. And both of those lead to reporting at the national level of how things are doing and trying to make sure that any adverse events are tracked and have an idea of what's going on with that.
Great. And there's a couple questions along this. If a health worker who is 1A, who is registering late because of, for whatever reason, hesitancy, how are they being put into the queue? Is it just with everyone in 1A and 1B? And then some of these are being taken up by Walgreens.
Yeah, so great question. So right now, today, we do not have a method of prioritizing anyone in 1A or 1B in terms of the queue and what's out there, right? We have an allocation amount. We have those allocation amounts tied to the people that are already in the queue. As we get more allocations that come in, as we determine where we can be more efficient in terms of different areas and things like that, then we can start to play around with some of those areas and figure that out. Walgreens is an example of an additional amount of vaccine that has come in. But like I said, the governor has been very specific about how he wants to utilize that additional surplus with the state. So I think there are options that are out there, and we can look at those. But like I've communicated in the past, right now we don't have a specific methodology for prioritizing one group over the other, because just you could also make the case that there are people in that 2B category that should get vaccine over others, right? You know, whether or not be older with multiple comorbidities versus younger in that 65 plus age bracket or things like that, and we just haven't scaled that out to prioritize people.
Great. We have a particular practice who had one patient and one healthcare worker who had reactions to the first vaccine. Each was recommended by follow-up care providers to be seen after reaction, and was to have the second dose in a hospital setting. And they're not sure how to coordinate this. Do you have any suggestions how to accomplish this in southern New Hampshire?
Yes, so the best way that I could think of to coordinate this would be twofold. One, obviously the PCP would make a recommendation to the hospital to be able to take care of this. I do know, and I am tracking, that most of the hospitals have a little bit of vaccine. We have not given them new allocations of vaccine, but they have a little bit of vaccine that they could go through. So you could coordinate with the hospital that you are part of, if you're a part of a hospital, to do this. Or you could reach out through the regional public health network to say, hey, look, is there a way to get one additional dose to an area and set up? So I would kind of see this as a twofold effort, and probably wouldn't happen very often, but basically where you'd want to obviously make your referral and get the hospital setting all set up. And then it would be a matter of taking a dose from a location, either whether it be second doses that are being received from a employee clinic at that location, or something else that you could go through and actually administer it for that second dose in a hospital setting.
Terrific. So we have a kind of a related question. There are a few bills out there, notably New Hampshire House Bill 220 and 221. And these are proposals, essentially anti-vax proposals, that would either allow opting out of the system or greater flexibility for participation, even among the childhood vaccines. And what I'll just say is kind of a sidebar, Mike Padmore, who directs our advocacy, will be working with them and other advocacy organizations across the state to coordinate that. If you're interested in advocating for against those bills, then please, send me your email address, your contact information, and we'll make sure that you're aware of when those hearings are taking place and how you can sign up for them. So I just wanted to touch base there. has anyone thought about how to distribute a single dose vaccine like J&J's vaccine that's being considered for emergency use authorization? And at this point, it's looking like distribution could be sometime in March. But have you begun to think about that in particular?
We've had some preliminary conversations, and we'll continue to work through this over the next month. I think that you've got, and I'm just going to speak personally to this. So this isn't necessarily CDC or the immunization section or anything else, but I think you've got, when you look at Johnson & Johnson's product, you've got two challenges there, right? Number one is it's a single dose as opposed to a two-dose series, which is a different battle rhythm than we've had before. And it's the ops and it's figuring out how to do that and make sure that that's documented and things like that. And so on the back end, that's making sure that our systems that we're documenting in and whatnot are prepared and able to handle that as a single dose point of administration versus a two-dose administration, so that it shows that the series is complete when it should be. That, in my mind, is the easier lift than trying to figure out with equity and allocation and external stakeholders and CDC recommendations and states surrounding us and whatnot about what do you do when there is a vaccine presentation that comes up and is not quite as high as some of the others, because choice is something that has been removed out of this response in terms of which vaccine you get. So it's not like I can go in and say, hey, I want that one instead of that one, right? At least at this point in the response. And so how do you utilize a vaccine that comes into your state that may not have the same efficacy rates or things like that? How is that best utilized and how is that best governed? And that'll be a decision of many different stakeholders and many different players to figure out how we game that out, what's responsible with that, and everything else. There's some very good things out of the Johnson & Johnson product, right? It's a single dose versus a multi-dose. It prevents serious mortality and morbidity in terms of the hospitalizations and the severe symptoms. So then it's okay for the epidemiologists and the MDs and the others that are part of our group, as well as our external stakeholders. How do we use that product to best effect to protect the citizens?
That's terrific. So I'm hoping if I can share my screen here real quick. I wanted to show you a slide, everyone. This was a slide that Dr. Benjamin Chan did at their last Thursday call. And as you can see, it kind of lines up right now, the various phases right now. And so based on the information that we have out right now, it looks like if you look that the Janssen J&J is likely to be considered later, and I think it's the third week of February for the emergency use authorization. And we're hearing mixed reports on the AstraZeneca, but I think they're still trying to make sure that their phase 3 clinical trials, that data is going to be submitted, and that I believe they're still trying to target sometime in March, probably latter March, for their EUA. And as you can kind of see that there are others in the pipeline right now, but they are a little, the Sanofi, Novavax. Novavax may be the third vaccine that has a chance to go for EUA sometime in March. And Sanofi is still it's just starting its second phase. So that's a little further out. So thanks, Brian, for letting me share the screen. If I can, there we go. Stop.
And what I'd say, Jim, is for Johnson & Johnson's product, I think what I've heard, and I apologize, this is anecdotal because I haven't actually seen it myself, but I think they're looking at EUA, possible EUA approval in the last week of February, with ACIP meeting over that weekend or something like that. So I think I think that's what's been generally messaged out. I haven't actually seen those emails, but that's what I was told.
Right. And typically, if it follows, it's at least 2 to 3 weeks for production to cycle up and essentially hit the distribution network. So likely it would be, it's my guess is it's probably going to be sometime the mid to latter part of March before we even potentially see any new influx of J&J vaccine into the equation.
Yeah, I don't on that part. I'm not quite sure because so what we've seen with the last two manufacturers, both Moderna and Pfizer, is that they started to produce vaccine at the point that the EUA was submitted, so that they kind of built up a reserve and had that amount to push out once the EUA was authorized. I have not heard anything from OWS yet as to whether or not Johnson & Johnson is taking that same tactic. It's a risk, right? In case they don't get approval, then they're out that production lost and things like that. And so I really don't know if they're doing that or not. But that's something that we've seen in the past. So it kind of makes the specifics of when we would start to see that product a little bit variable in terms of whether or not it really would be kind of first week of March or whether or not it might be later on.
Right, good. So we don't have any other questions. If you have one kind of last chance, if anyone has any last minute questions. But TW, as always, thank you very much. So we're going to try to give TW a break. These are kind of some of the major changes. I encourage everyone to pay attention and sign into and watch the governor's press conference today, which I believe is scheduled at 3, because there'll be more information on what we just discussed as part of that. Next week, what we're going to try to do is focus a little bit more on the communication aspects, and then we'll see within a couple of weeks if there's more of the allocation process to kind of report, and we can have TW back. But plan on next week that we'll start talking about doing some specific targeting on what we can do to the 1B population, and any follow-up for any of those who are 1A candidates who maybe that hesitancy is passed. So I think we'll try to focus in the next couple of weeks on really trying to help clean up those first 2 phases, get as many of those people as we can registered initially. And then we'll begin talking about the next phases and how to prepare, how to start segment for various influencers, and how we can start and how we can arrange audiences with some of your specific groups for those influencers to help make sure that they're comfortable. So when we start hitting phase 2, that they can start being part of that multiplying force to support getting shots in the arm. So again, TW, I didn't see any more questions. Again, thank you very much for all of your time and your hard work. Please convey to your colleagues thanks from all of us for the tremendous work that you all are doing.
Thank you guys very much, and thank you all for the good work that you're doing out in the community. I know it's not easy when there's a scarce resource to try and provide that to our patients and whatnot to get them going in the right location and the right resources and all of that. So I know you all don't have an easy job just in this one facet, let alone all the other constraints that COVID has put on our relationships with our patients. So thank you guys for the good work that you do, and we appreciate your partnership. Have a good rest of your day.
Thank you. Thank you very much. Take care, everyone.